Hello, everyone, and welcome. We already have some people joining. I am Ana Molina from MHPSS.net, and we are very happy to be hosting the webinar Unlocking Resilience, Health Social Counselors, and Mental Health Support in Afghanistan in collaboration with HealthNet TPO Afghanistan, who will be presenting it. I will pass the word to Dr. Majeed Siddiqi in a minute to introduce the speakers.
Thanks, Valeria, for introduction, and also thanks for MHPSS.net for hosting and facilitating the webinar. So, good morning, good afternoon to everyone. I'm Dr. Majeed Siddiqi. I'm Senior Public Health Advisor of HealthNet TPO and today's moderator of the webinar. So it is an honor on behalf of HealthNet TPO to welcome you all to today's webinar. The topic of the webinar is Unlocking Resilience, Health Social Counselors and Mental Health in Afghanistan. So we are here to explore a vital and often overlooked aspect of mental health care, the psychosocial support. One that is especially crucial in the context of fragile and low-income countries such as Afghanistan. So as you may know, Afghanistan has faced decades of conflict, social upheaval, and economic hardship, all of which have taken a toll on the mental health and well-being of individuals and communities. In such a context, the role of health social counselors becomes increasingly important. These new professional cadres, an innovative approach of HealthNet TPO and some other NGOs in Afghanistan serve as a bridge between healthcare system, community resources, mobilization, and meeting the individual needs of mental health and psychosocial support. So HealthNet TPO is in Afghanistan for last 3 decades. And we are working in health system strengthening, and also much focus have been in last 2 decades on strengthening the mental health and psychosocial support in the country. So one of our experiences on health social counselors training program, that is what we have the webinar for today. So the purpose of today's webinar is to shed light on the critical work being done by health social counselors in Afghanistan. We will discuss their role in promoting mental wellness, supporting individuals affected by trauma, and advocating for better mental health planning, coordination, providing support to community health workers, and mobilizing resources within the community. Thus, we are looking at health social counselors, which are part of the health system, not only providing counseling, but a number of critical roles in MHPSS services at district and sub-district level, and very much focus on rural areas, aiming to cover the current gaps which in the health system, which is the coordination, planning, implementation, and mentorship of the MHPSS in the country and many other fragile contexts. So throughout the session, we will have insightful presentation from leading experts in the field, followed by sharing of our health social counselors where they have direct contact with the beneficiaries. So we will delve deeper into the challenges and opportunities facing health social counselors in Afghanistan today. We also encourage you, our valued participants, to engage with us through questions and reflections in the chat. So at the end of this webinar, we will have some discussion in responding to your questions and to make sure this is a collaborative space for learning and sharing. So our first speakers are Dr. Najeebullah and Dr. Zalmai Shinwari. Dr. Najeebullah is the program director of HealthNet TPO in Afghanistan, and he is a public health expert with more than 15 years of work experience in the country. So he will be joined during our first presentation with Dr. Zalmai Shinwari, who is a psychiatrist by profession and is engaged in mental health and psychosocial training programs and currently leading the MHPSS activities of HealthNet TPO in Afghanistan. So thank you for being here, and we look forward to a meaningful and productive session. Let's get started. So with our first presentation by Dr. Najeeb and Dr. Zalmai. So please, Dr. Najeeb, go ahead.
Thank you so much, Dr. Majeed and Vilaria. Can you hear me clearly?
Yes. Yeah.
Thank you. Thank you, Dr. Majeed. Assalamu alaikum. Good morning, afternoon, everyone. Afghanistan team is delighted to present on behalf of the HealthNet TPO an overview of the mental health and psychosocial support in Afghanistan. The presentation will focus on the unlocking resilience, exploring the essential role of health social counselor in transforming mental health and psychosocial support in Afghanistan. You all better know that mental health is a critical consideration and super important for everyone, everywhere. And the statistics and reports from the mental health services indicate that there is a growing need or demand for mental health services globally, particularly in countries impacted by protracted war and where we need to prioritize the mental health services. When it comes to transformation of mental health services, so it's critically needed to focus on mental health and psychosocial support services so that can ensure improving access to the services and preventing the social exclusion of the people with mental health conditions or problems. Next slide, please. The outline of presentation, we will talk about the country context, the mental health situation in Afghanistan, health social counselors, their role as change agent in the health sector, challenges encountered and way forward for improving the mental health and psychosocial support in Afghanistan. Yeah, next, please. The country context, Afghanistan is a landlocked country located in the heart of South Central Asia. The total population of the country is estimated to be 42.2 million. The protracted war in the country is leaving more than 2 million casualties. That was started in 1979 with the invasion of Soviet forces in Afghanistan. Until now, the protracted war in country, as I mentioned earlier, is leaving more than 2 million casualties, 6.4 million refugees, and more than 4 million internally displaced people across the country. Next, please. The Afghanistan Living Conditions Survey that was conducted in 2016-17, it reports that more than 50% of the country population live under the poverty line. And the humanitarian response plan developed for 2024, it estimates that over half of the population, are 23.7 million people, are in need of humanitarian assistance in country. Next, please. As you know that our country undergone over the 4 decades of war due to the long suffering of population in country, poverty and personal losses. Mental health problems or issues are pointedly prevalent in Afghanistan and in our population. The recent last survey, the National Mental Health Survey, which was conducted in 2018, that's the last survey conducted nationally in Afghanistan, reported almost half of the country population, they suffers from the psychological distress or various mental health conditions in country. Of this 50% of the population, are more than 20 million people. 24% of them, they compromised their professional role due to the mental health problems. Next, please. This 20 million population, which is almost 50% of the total country population, they experience different kinds of mental health issues. 1.14% of the population, are 480,000 people, they experience psychosis. 2.7% of the population, are more than 1 million people in country, they experienced anxiety. 5.34% of the population, are more than 2 million people, they experience PTSD, post-traumatic stress disorder. 4.86% of the population, are more than 2 million people, they experience depression, which is higher than the estimates what we have for global burden of the depression, which is less than 3% of the total population. Globally, they suffer from depression. 3.4% of the population, more than 1 million or 1.4 million people, they attempted suicide, and 7.2% of the population, more than 3 million, they had suicide ideation, and 8.2% of the population, more than 3 million people, they developed substance abuse. Next, please. When it comes to the mental health situation or mental health burden in children, similar to the adults, children, they are also suffering from the various mental health problems in country. 57% of the children, they experienced any mental health problems in country. 40.7% of this population among children, they suffer from conduct disorders, and 40.4% of the children, they experience total difficulties, and 39% of the children, they experience emotional problems, and 15.5% of the children, they are suffering from the ADHD. So this was a brief overview of the mental health situation in children in Afghanistan. Next, please. We have several impediments to accessing mental health services in country. The major obstacle or barrier toward accessing mental health services in country is the insufficient human resources. I mean, the qualified professional for delivering mental health services for the population, followed by lack of space or insufficient space and health facilities for the mental health services, a lack of capacity, regular capacity building programs for the mental health cadres, and lack of medicine, education, and stigma within the community. So these are the main barriers to accessing mental health services in country. Next, please. When it comes to the landscape of mental health in Afghanistan, over the past 2 decades, the health sector of Afghanistan has made considerable achievements where HealthNet TPO is actively participating in both delivering health services and the development of the SOPs, policies, and strategies for mental health and Ministry of Public Health. When talking about the leadership and governance in this fundamental area, we have a lot of progress, including the mental health policy and strategy developed for Ministry of Public Health. We have national suicide prevention policy or strategy. We have mental health legislation and act of code and code of practices. We have mental health department established within the Ministry of Public Health, and we have Health Social Counsellors department established within the Ghazanfar Institute of Health Sciences under the umbrella of Ministry of Public Health. An information system and evidence generation, we have several research articles published in national and international journals about mental health. We have National Mental Health Survey that was conducted in 2018, and integration of the mental health indicators into the National Health Management Information System and DHIS2 in country. Coming to the responsive MHPSS services or integration. So we integrated the mental health services into the primary healthcare and secondary healthcare packages. We have specialized mental health services at secondary and tertiary level. At secondary level, we have 5 psychiatric units within the regional hospitals and 5 regional hospitals. We started the community-based mental health initiatives, including the PFA, psychological first aid, the PM Plus program, school mental health program in country. We have undergraduate and postgraduate training programs for mental health cadres. More than 200 psychiatrists, they are graduated from the postgraduate medical education program in psychiatry. We have 316 clinical psychologists in country, and more than 800 psychosocial and health social counselors who are working in both the health sector and outside of the health sector and in different sectors where the work of health social counselors are needed and crucial. Next, please. Now I will hand over to my colleague, Dr. Zalmai Shinwari, who will walk us through the evolution process of health social training program in country in the next slides that we have in this presentation. Thank you. Dr. Zalmai, please.
Thank you, Dr. Najeeb, and good afternoon and good morning, everyone. Evolution of the Health Social Counselor Training Program. For the first time, integration of MHPSS services at the primary healthcare level was piloted in some district of Nangarhar by HealthNet TPO in 2003. And after successfully completion, the program it is expanded to the 7 EC EU funded provinces in Afghanistan. And in that program, we train medical doctor, nurse, midwives, and community health workers to provide MHPS services at the primary healthcare level. Fortunately, in 2009, mental health department together with the mental health stakeholder develop a learning resource package for psychosocial counselor to train psychosocial counselors to provide psychosocial services at the comprehensive health centers. So this learning resource packages consist of 3 months intensive training and followed by the 2 weeks refresher training, including under supervision training. Unfortunately, in that time, it is 850 psychosocial counselors receive 1 year's training certificate from mental health departments, and this program was implemented by mental health stakeholder, including HealthNet TPO. And 2018 and in 19, HealthNet TPO together with mental health department advocate to upgrade the 1 year certificate programs to diploma training program to recognize as a cadre. Fortunately, in that time, Ministry of Public Health accept the new cadre as a health social counselor and develop the curriculum for these new cadres and establish the Health Social Counselor Department in Ghazanfar Institute of Health Science that is working under the MOPH Ministry of Public Health umbrella in the train and mid level. So new cadre is added in this program. And for the standardization, the program accreditation system was developed for the health social counseling training program. And fortunately, in previous project, this is funded by you and together with the Institute of Health Science, Ghazanfar Institute, 282 health social counselor has been upgraded and train and recognize a new cadre, and they are working at the comprehensive health centers and other vertical project. Next slide, please. Next slide, please. Thank you. The health social counselor rule, provides MHPSS service, including individual and group counseling session within the health facility, especially in comprehensive health centers, and conducted awareness raising session in providing mental health education in coordination with medical doctor and nurses, midwives within the health facility and with community health workers, and provide technical support for the midwives. They are working at the health facilities they are receive a basic psychosocial counseling training, especially midwives and community health supervisors, and maintaining registration and submitting monthly report to the health facility level. The scope of this position, this health social counselors, is not limited to the work with the Ministry of Public Health. In these 2 years diploma training program, social work part is added in this curriculum to broad their scope for their working. So they work with Ministry of Labor and Social Affairs and drug demand reduction programs and Ministry of Education and Ministry of Justice. Next slide, please. Progress in health social counseling training program. And now we train 220 health social counselors. We upgraded and trained them by HealthNet TPO, and it is funded by European Union. Also the Health Social Counselor Program Department establishing Ghazanfar Institute for regular to train Health Social Counselor diploma holder for sustainability the programs. and strengthening the health social counselor accreditation system for standardization of the program. Next slide, please. If we see the mental health case identification at the Comprehensive Health Center in CHC, where the health social counselors working there, so it is year by year, it is increased the identification case and management cases. Only during the COVID-19 pandemic in 2020, 21, and 22, the trend is decrease. Next slide. Challenges. We have only one psychosocial counselor at the Comprehensive Health Center according to the basic package of health services of Ministry of Public Health. However, to provide MHPSS services for the affected population, however, there is needed to employ two psychosocial counselors due to the culture restriction in Afghanistan. The female psychosocial counselors only provide counseling session, conduct counseling session with the female clients, and male psychosocial counselors conducted counseling session only with male clients due to cultural restriction. Therefore, there is needed to add it at least two psychosocial counselors at the system to provide counseling session for the affected population in male and female, including children, to provide services for them. And the other challenge is low priority to MHPSS. As previous slides, Dr. Najeeb mentioned that it is a high incidence in prevalence rate of the mental disorder in psychological distress. So it is too high. There is needed for the psychosocial services at the primary healthcare level and community level and secondary level. And only we have a limited service at the primary healthcare level. And also we have a limited capacity. The women moment in access to the health services is limited, as you know that there is needed to mahram with the accompany with these women to receive a psychosocial counseling, and limited capacity in MHPSS. Before that, I mentioned that only we in Afghanistan, we have a psychosocial support at the primary healthcare level, but it is limited services at community level and also secondary level. So there is needed to be strengthen this program at the primary healthcare level to access the people for these services, and also to provide services for the affected populations. Next slide, please. A way forward and health social counselor as a catalyst of MHPSS services. The health social counselors in future, so it is not limited to provide services within the health facility to provide provide counseling services, individual or group counseling to affected population. Their role is extended to support and coordinate a community MHPSS services and school mental health programs, and other provide in coordination with other sectors like social affairs and drug demand reduction programs, and coordination and refer the cases to specialized care where is needed to referral strengthen the referral system at the different levels. Please, next slide. Thank you for your attention. Thank you.
Thank you, Dr. Najeeb and Dr. Zalmai. It was a very interesting presentation, what has happened last 2 decades in Afghanistan. and how we are moving with integration of MHPSS at different levels. Especially interesting is looking at the countries with fragile and chronic complex situation like Afghanistan, how the MHPSS is part of the health system, how it can be sustained, and how it can be part of the multi-sectoral approach. So the health social counselors futuristic view is that they are as a nucleus, as a hub, as a center in a district in rural area to provide support to the whole MHPSS services within health facility, within the community, within other sectors. So I find it very interesting. There had been challenges and there will be challenges, but it is a very interesting example. I think half of the health social counselors or more than half are female. So still the training is going on for the male and female health social counselors in different 3 provinces, I think. So for the whole country. So that's a continuous process. With current challenges, still it goes on. So we have our second presenter is Mezhgan Sadat. She is the master trainer and she's a psychologist, and she will explain the content of this training program and how she is feeling about current situation and how she is looking at future for continuation of this health social counselor training program. Now, Mujgan Sadat, it is I'm handing over to you, and please go ahead.
Okay. Hello to all. Hope you are doing great. First of all, thanks a lot from Dr. Saib to give me an opportunity to explain about HSC curriculum in Afghanistan. As Dr. Saib Zalmai mentioned before, the Health Social Counseling program, the Psychosocial Counseling program was launched in Afghanistan. However, this program could not effectively address the psychosocial challenges present in Afghan society, and the PSC curriculum was redesigned into a 2-year HC diploma program based on the MHPSS service in Afghan society. And this curriculum includes 3 main parts: public health, psychosocial counseling, and also social work. In the public health section, students focus on counseling individuals affected by communicable and also non-communicable disease, as well as basic research subjects. And the second part emphasizes the counseling techniques. Students gain knowledge about counseling theories, also advanced counseling techniques, and a psychology subject and psychopathology. And the third section of this curriculum focus on social work, which involves working with individuals, family, community, group, and addiction, also working with child and adolescents. This 2-year HSC diploma program is implemented in 2 ways. One is a tailored program for those counselors who are already completed the 1-year psychosocial counseling program, and they are currently working in their own health facilities. And this program consists of a 6-month training duration that the counselors spend 1 month in training center, and the next 2 months they spend on their own health facilities, and they will do their practical work. And during their practical work, they are under our direct supervision. And during the 1 month in-class training, students acquire both knowledge and skills, and we focus on important methodologies such as role-playing, group working, sharing self-experiencing, and also case studies. And my experiences has shown that using this methodology enables students to easily learn the required skills building and face fair challenges in their own health facilities. And also, as I mentioned before, they spend 2 months on their own health facilities, and during their practical work, they are supervised through online group and also on-site supervision, and they do their practical work, and also we provide them small projects that they do their practical work, or they complete their practical work on their own health facilities. And also, as I mentioned, we implemented this program in 2 ways. And one is the Health Social Counseling program. This program consists of 4 semesters, each lasting 4 months. And this program methodology is as the same as Health Social Counseling program, upgrading program, I think so. And as someone who has direct contact with these counselors, and we are well aware of their challenges, I see that they still need further knowledge and skills, and they are not yet sufficiently empowered to address and manage all the cases that come to them. And my recommendation as a master trainer is to focus more on enhancing capacity of counselors so they can upgrade so they can upgrade to a bachelor's level. And I think with this way we can offer maximum services to the community with limited resource. Thanks from your time and from your attention.
Thank you, Mezhgan Sadat. I think everybody agrees with counseling, with group individual counseling. We need a very skilled health workers, and the program is started with a 3 months training program by IPSO sometime long ago, and that is how it is evolved to 1 year diploma program, and now a course into 2 years diploma program. But still, we feel with counseling, the sensitivity and the skills needed. And also, we are looking at the health social counselors to diversify their role, to be have a nucleus for the MHPSS in a district, sub-district level, that there is more competency and skill building is needed. So hopefully we are able to upgrade it for another 2 years and advocate for that, and hopefully other organizations are coming forward too. And that is, we are looking at health social counselors at not only counseling, psychoeducation, and group counseling, but also the planning, coordination, referral, mentorship. So a diverse role for the health social counselors. So let's work further on that, and let's see how it is moving. So thank you very much, Mezhgan. And we are going to our third speaker, is Firoozeh Yaqoob. She is a psychosocial counselor. Let's hear first-hand information from her about how she is learning through this training program and how she is helping others in the health facilities. So they are the frontline health workers, and they are actually providing the services. Over to you, Firoozeh, and Sherzad will be translating. Thank you. So we will have in Persian and then translation simultaneously. So bear with us. It is not simultaneous translation, but we will have a speaker, our counselor speaking in local language, and then we will have translation too. So over to you, Firoozeh.
با عرض سلام خدمت همه. مشاور روانی اجتماعی هستم که مدت 8 سال است در یکی از کلینیک‌های کابل ایمی خدمات انجام میدم که سرتیفیکت 1 ساله دارم و نظر به کریکولم درسی 1 ساله داخل کلینیک و خارج از کلینیک همی خدمات بخش مشاوره را به مراجعین عرضه میکنم.
I'm a psychosocial counselor with 8 years of experience in this field. I have obtained 1 year certificate in psychosocial counseling, which allowed me to provide psychosocial counseling services in clinic and outside of them during this time.
در داخل کلینیک ارائه آگاهی‌دهی است و مراجعین و همچنین انجام جلسات گروپی و انفرادی است و همچنین هماهنگی تیمی که با دکتر داریم. مراجعینی که از طرف از اونا بر ما راجع میشه با یکی از اختلالات روانی مانند افسردگی، اضطراب، تروما، امی خدمات بخش مشاوره را برشان انجام میدیم.
Clinic by providing awarenesses and conducting individual and group psychosocial counseling
Can you speak loudly? I cannot hear you. Yeah.
In the clinic by providing awarenesses and conducting individual and group psychosocial counseling session with clients and coordination with clients that was referred to me by a doctor in health center. I work with them on common mental disorders such as anxiety, depression, and trauma, which proved effective and helpful, resulting in good outcomes.
و همچنین در بخش مداخلات روانی با استرسورهای روانی اجتماعی مانند سوگ، منازعات خانوادگی، تحولات دشوار و مشکلات شخصی هم با مراجعین اینمی خدمات بخش مشاوره را انجام میدیم که بسیار بر آنها مؤثر تمام شده و نتیجه خوبی داشتیم.
Additionally, in the field of psychosocial intervention, I provide services to clients dealing with psychosocial stressors such as grief, family conflict, difficult transition, personal issues, and etc.
و خارج از کلینیک قبلا در مکاتب و همچنان خانم هایی که در کارکن صحی بودن آگاهی دهی در بخش امراض روانی داشتیم و اینکه کدام خدمات ما عرضه میکردیم برای در کلینیک های خود برشان آگاهی دهی میکردیم تا اینکه سطح آگاهیشان هم بلند بره و همچنان استیگمایی که درباره امراض روانی در جامعه وجود داره ما بتونیم از طریق او از بین ببریم و همچنانی که ما مراجعین از طرف از اونا هم داشته باشیم.
Before outside the clinic, I conduct awareness programs in school and for female community health workers to inform about mental disorders and the services available in this field. And I was able to raise people awarenesses through this approach, resulting in contribution to reducing stigma in the community. Now more clients are seeking psychosocial services.
با وجود این همه خدمات بازم ضرورت احساس میکردم که باید به این بخش و تحصیلات رو ادامه دادم، چون که بعض اوقات در بعض قضایا مانند اضطرابات شدید، افسردگی های مزمن، کار با معتادین، کار با کودکان دچار مشکل می شدم که خوشبختانه حال زمینه تحصیل برام فراهم شده از طرف HealthNet که در جریان تدریس هستم و با سپیر نمودن یک فیز درسی خود توانستم که اون مشکلات ما هم حل شده و حالا با امراض ساری مزمن مانند HIV و طبی بخش مشاوریش انجام میدم و همچنان در امراض غیر ساری مثل سرطان‌های سیدی، امراض قلبی و دیابت هم با اشخاصی که اینمی امراض داشته باشند بخش مشاوریش انجام میدم.
The services that I provide I feel the need to address some cases such as chronic anxiety and safety.
Can you speak loudly?
As well as work with children and adults, which provides challenging. Fortunately, the HealthNet program provides a chance for me to continue my education and service training in Health Social Counseling Diploma program. After completing 1 semester of studies, I now also consult patients with communicable diseases like TB, HIV, and those with non-communicable diseases such as breast cancer, diabetes, and heart conditions.
خیلی احساس خوشبختی میکنم برای اینکه توانستم حداقل استرس همی اشخاص که امراض مزمن دارن و همچنان ساری و غیر ساری دارن استرس از اینها رو کاهش بدم و همچنان بر از اونها انگیزه بدم تا اینکه به خاطر بهبود خود تلاش کنن، جامعه را و فامیل خود وقایع کنن و همچنان در کاهش استیگما و آگاهی دهیشان نقش فعال داشتن.
I honestly feel fortunate to have been able to reduce the stress experienced by individuals with chronic illness and to encourage them to utilize their ability and available resources for self-improvement. Additionally, I worked hard to help them protect their family members and community while actively participating in reducing stigma and raising awareness.
و باز هم توقع دارم که در این بخش تا سطح لیسانس و ماستری و تحصیلاتم ادامه بدم، چون که جامعه ما واقعا ضرورت زیاد داره به این خدمات.
I also hope to continue my education up to the bachelor's and master's levels because our society truly has need for it.
تشکر.
Thank you.
Thank you, Firoozeh and Shahrzad. So we will be going, because looking at the time, we are going to Raeesa Niyaazi, and then we will be responding to the questions in the chat and concluding. Thank you very much.
Thank you, Dr. Saib.
Raeesa Niyaazi, yeah.
سلام خدمت همه. مشاور روانی اجتماعی هستم که مدت 8 سال می شود در کلینیک 12 ایمان پغمان کار می کنم. سرتیفیکیت 1 ساله مشاوری روانی اجتماعی را داشتم. خوشبختانه توانستم در برنامه آموزشی دیپلم مشاوره اجتماعی صحت با هلتنت درس بخوانم و اکنون فارغ از این برنامه هستم.
Hello for everyone. I have been working at the 12 Imam Pagman Clinic for 8 years. I received a 1-year certificate in psychosocial counseling. Unfortunately, I was able to study the diploma program for Health Social Counseling with HealthNet, and I have now graduated from this program.
با خواندن دوره 1 ساله مشاوره روانی اجتماعی زمینه کاری ما محدود بود، اما با تمام کردن برنامه آموزشی دیپلم مشاوره اجتماعی صحت اکنون من میتونم با قضایای مختلف مانند جلسات مشاوره انفرادی، گروپی، خانوادگی، با اطفال، نوجوانان، با معتادین، با مریضان دارای امراض ساری و غیر ساری با استفاده از مهارت‌های مداخلوی جدید کار کنم.
With a 1-year course in psychosocial counseling, our work chances were limited. However, after completing the diploma program in health social counseling, I can now work in various issues through individual, group, and family counseling sessions with children and adolescents with addict and with patients suffering from both communicable and non-communicable diseases using new intervention skills.
به طور نمونه که یکی از قضایایی که من کار کردم، پسر 9 ساله که صنف 4 مکتب بود، مادرش نزد من آوردش و گفته مادرش این پسر مخرش شده، شب ادراری داشت، در خواب میترسید و مکتب و درس بی علاقه گردیده بود، بدون دلیل گریه میکرد و در مکتب نمراتش پایین آمده بود.
For example, one case that I worked on included a 9-year-old boy in 4th grade. His mother brought him to me saying that he had become disruptive, had bedwetting, was afraid while sleeping, had lost interest in school and lessons, cried for no reason, and his grades had dropped.
من با استفاده از مهارت‌های مداخلوی جدید مثل رسامی، قصه درمانی و بازی درمانی مشکل اساسی این پسر را دریافتم که معلمش در مکتب این پسر را لطکوب میکرد. با گرفتن چند جلسه انفرادی مشاوره انفرادی همراه این پسر و 1 جلسه همراه مادرش کار کردم که حالا این پسر به شکل عادی مکتب میره، دوباره به مکتب علاقه پیدا کرده و روزی که نزدش بود خوب شده.
Using new intervention skills such as drawing, story therapy, and play therapy, I discovered that the underlying issue for this boy was that his teacher was physically abusing him at school. After several individual counseling sessions with this boy and 1 session with his mother, he now attends school normally, interested in his study, and the symptom he was experiencing have all improved.
قضیه دیگر دختر 20 ساله که بند دست خود را همراه شیشه بریده بود و اتاق عاجل مراجعه نموده. بعد از اینکه نرس دست خانم کوک زد نزد ما فرستادش. این دختر بسیار افسردگی شدید داشت با افکار خودکشی و و قبلا چند بار دیگر هم برای خود ضرر رسانده بود. این دختر را فامیلش در یک اتاق تاریک بندی کرده بودند که دیوانه است.
Another case involved a 20-year-old girl who had a casual waist with glass. She was transferred to emergency room of the clinic and nurse treated her hand. She was referred to me. This girl was suffering from severe depression and with suicide behavior. Her family had locked her in dark room, believing she was crazy.
من با گرفتن 7 جلسه انفرادی مشاوره همراه این دختر کار کردم و یک جلسه همراه فامیلش داشتم. حالا این دختر بسیار خوش است و به زندگی خود مثل دیگران ادامه میدهد و سطح آگاهی فامیلش و استیگمایی که در برابر این دختر وجود داشت از بین رفته است.
I work with this girl through 7 individual counseling sessions and had 1 session with her family. Now this girl is very happy and continues her life like others. The level of awareness of her family has increased and the stigma that exists against her has decreased.
با این هم پیشنهادی که دارم این است که نظر به مشکلاتی که ما در ساحه کاری خود اکنون داریم، این ضرورت را احساس می نمایم که زمینه مساعد شود در بخش مشاورت تا سطح لسان و ماستری و تحصیلات خود ادامه بدهیم. هر قدر که دانش و مهارت ما بالا برود و همان قدر خدمات بیشتر و موثرتر به کسانی که مشکل روانی دارند ارائه کرده می توانیم.
Despite this progress, I feel the need to continue my education up to the bachelor's and master's levels in counseling due to the challenge we still face in our field of work. The more knowledge and skills we gain in this area, the more effective services we can provide to those who have mental health issues. Thank you.
Thank you, Raeesa, Niyaazi, and also Sherzad.
Thank you, Dr. Saib.
Yeah, I think we heard about the very good experiences, how they are helping the children and girls and women. And there are limited number of the health social counselors in the country where they provide services through the health system and all over each province and all over the country. So that is a very interesting model, which is unique in many developing countries. If I'm looking not only Afghanistan, that is within the rural areas, how to make sure the psychosocial support is provided. And but there is also a need to continue expand the program and also continue the education. So that is the big need I am hearing from our health social counselors. I appreciate their hard work. So we are coming to the question answer session, and Valeria, if you put the questions and respond to those ones. So we have Dr. Zalmai and Dr. Najeeb, so they can respond to the questions, and we will conclude in 6 minutes and maybe additional 1-2 minutes if possible. Yeah.
I can read the first question if it helps.
Yes, that is
So,
great.
yeah, Monica Vega Chompi asked, she says she wonders, in such a challenging context in terms of women's rights and their needs, how gender considerations were integrated in the training of these counselors, as well as how to cope with mental health needs associated with experience of gender-based violence. Please.
Valeria, before Zalmai Shinwari can go for answer, if we have, I consider 14 questions, can we have 5 minutes more for this webinar, or it will be 5 minutes only to answer?
No, yeah, we can have more.
Okay, thank you. Zalmai, Dr. Zalmai and Dr. Najeeb, if you can be brief and respond to that.
Thank you so much, Monica, for the question, posting the question. Yeah, indeed, the women issues in country. So this has to be dealt, and we have to ensure equal opportunity in terms of the services delivery and training programs for both women and men. When it comes to the specific training program, the Health Social Counselors training program, luckily, we consider the gender balance in the training program. We have more than 60% of the female trainees enrolled in the training program, and after the training sessions, they are going back to the health facilities and providing the psychosocial and health social counseling sessions for the women beneficiaries across the country and all 34 provinces. Similar, we have male psychosocial counselors enrolled in the training program. The percentage is less than 50. It's close to the 50%. That aspect has been already taken into account in the training program. The health sector, we have somehow exemption in the health sector, where the female staff, they are working in health facilities and hospital providing services to the female beneficiaries. There are no major impediment to the female staff working in the health facilities and hospital, except the new requirement for the mahram, that they has to be accompanied by their mahram while they are traveling.
Dr. Najeeb, can you be brief? We have a time problem.
Yeah, thank you. So that aspect has been considered in the training program and also the health.
So we are using the same curriculum which was developed around 4 or 5 years back, 1 years back. So it is the same curriculum is used for training.
Yes.
Okay. Thank you, Velam, for putting the question. Is there any difference in acceptance in use of MHPSS services in different parts of the country?
Actually, due to the stigma, yes, it differs. The acceptance of the MHPSS services in different parts of the country, but we do not have any exact data where we have more prevalent a percentage of the stigma in which part of the country, but indeed it differs in terms of acceptance of the MHPSS services.
So we have, again, the same overcoming stigma. I think that is responded. So that is an issue. Stigma is an issue and differs in different parts of the country and within also provinces. There is issue within different women and girls and boys. So there is an issue, stigma, that is shown in the survey which was conducted. It is one of the barriers accessing the MHPSS services.
Exactly.
So there's also from Velam a question if HealthNet TPO is alone or many others. So many others, they provide MHPSS services in Afghanistan, but HealthNet TPO is main organization providing this 2-year diploma program beside the Ghazanfar Institute of Health Sciences. So but this program, 2-year diploma, is more focused on rural areas, selected from the villages, from the districts, and providing the services. So yeah, sure, there are many other NGOs, there are different HER project, BPHS implementers, and WHO and others, they provide MHPSS. But the health social counselors, we are looking as a nucleus, as a hub, as a catalyst for MHPSS that is unique, what is we are promoting as a HealthNet TPO. The question is, Dr. Zalmai, to you, is counseling accepted in all provinces currently? Dr. Zalmai?
Thank you, Dr. Majeed. Yeah, the psychosocial counseling is provided at the CHC Comprehensive Health Center, located across the country in different health facilities, like amount of health facility at the country level. So in some provinces we have 6 or 3 or 5 or 20 comprehensive centers, and they provided psychosocial counseling to the affected populations. So only we have a restriction on the male and female counselor. So right now we have only one psychosocial counselor at the system. So if the psychosocial counselor female, so they are provided only for female psychosocial for female clients, affected population, the services. So male is deprived from this. So therefore we recommend it to we have at least 2 psychosocial counselor at the comprehensive health center to provide for both male and female affected populations psychosocial services.
And also, Dr. Zalmai, there's a question for these health social counselors. What type of ongoing psychosocial support you are providing during and after training? So, because they are also facing trauma, secondary trauma and stress related to work. Can you explain how you're doing?
Yeah, for before that, I mentioned in my presentation that we train psychosocial counselors, and we provide technical support for in-service training for the psychosocial counselors. And during the training, we have a group supervision session. And group supervision sessions, they express their feelings, and also they learn from each others. And also during the training, we have a session with them for their healing of the mind. So they have as you know that everyone affected from they working in the mental health, they are affected by the clients. So therefore we have group supervision, individual supervision for this psychosocial counselor to express their emotion to reduce their stress in their duty areas.
Thank you. Mezhgan, can you add to that one? Because we have a specific program for the secondary trauma for our health social workers. Mezhgan, are you there? Can you add to this?
Okay, Dr. Saib, can you repeat it?
We will provide with our health social counselors support for secondary trauma because of their work-related stress. Can you elaborate? We have a specific program, I think, for that. How you
Okay,
do
Dr.
it?
Saib. Okay, also, as Dr. Saib Zalmai mentioned, yes, we have plan for their self-care, and we have a chapter that it is specific for self-care plan, our counselors, and sometimes every time that they have a problem, they call us, and we give them some services that they need.
Okay. Okay, thank you very much.
Welcome, Dr. Saib.
So the question is, how do you collaborate with other sectors like education, health protection to enhance overall effectiveness of MHPSS services? That is question raised by Mohammed Saeed. Yeah. Dr. Zalmai,
Okay.
Najib, yeah. Or Mezhgan, yeah, any of you.
Yeah, thank you, Dr. Majeed. There is intersectoral collaboration among the different sectors: health, education, protection. We have different clusters. They are meeting on periodic basis and discussing the mental health and protection issues among the clusters where different stakeholders are members of these clusters. HealthNet TPO recently completed an assignment with UNICEF where the main focus was on integration of the MHPSS into the protection, the education, the social behavior change communication. So the integration activities are closely in discussion with the stakeholders that they are working in these sectors, and HealthNet TPO is actively contributing to the integration of the MHPSS into the other sectors, including protection, the education, WASH, and the SBCC. Thank you.
Thank you. And how was the health social counselor training curriculum was designed and validated? It is from Abdul Wahab. So if I pronounce it properly, your name. Dr. Zalmai, how this curriculum was developed when and how it is validated, it is approved. Yeah.
Yeah, thank you, Dr. Majeed. In my presentation, I mentioned that for the first time in 2009, the LRP learning resource package is developed. It is pilot in Mazar-e Sharif, and the intervention is showed that there's acceptance of that. So, and the work for the anxiety, depression, in post-traumatic stress disorder sign and symptoms. So there is a control RCT and conducted in the Mazar-e Sharif. So if they were, therefore it is adapted. And after the 1 year's curriculum was only upgraded to 2 years curriculum, so added some topics, and we have a committee in here at the MOPH Ministry of Public Health level, and different stakeholder that we have a adoption committee for that, in for revision and contextualization of the training materials, in especially for health social counselors.
So it was a 2-year diploma program was designed at Ministry 2019, I think it was, and also approved by the Ministry. It is part of the Guidance Institute of Health Sciences, part of the government system. It was. So it is part of the system. It is approved, and there is accreditation mechanism for training program also.
Yes, yes, yes.
So we have from Willem a question about the graduate counselors' job opportunities within NGO, within government, and with private practices. Dr. Najeeb?
Yes, thank you, Willem. There is a greater demand in terms of the job opportunities for psychosocial counselors within the health sector and outside the health sector. In the health sector, we haven't yet reached to the saturation level to have at least one psychosocial counselors, a counselor, or health social counselor in each health facility. So we are working closely with the donors and Ministry of Public Health to have some revolution in the policies in order to have at least 2 psychosocial counselors in each health facility, 1 male and 1 female, to ensure the services are provided to both genders, male and female. So there is a greater demand, and inside the health sector and outside the health sector and other sectors that was mentioned in our presentation. Thank you.
Yeah, there is an interesting question, but maybe difficult to answer, about reducing the mental health stigma by HealthNet TPO. So we are part of the whole system and organizations working on MHPSS. Still, there is only one nationwide survey 2018 on mental health where the stigma was shown. It was around 4-5%, I think, if I'm correct. So that is still has to be looked in long term if there is any impact. But stigma is part of our curriculum training program and also part of psychoeducation and awareness activities. So it is part of the activities where we want to see reduction in stigma and better access and also acceptability within the community on mental health conditions. So that is part of it. There is also a question how I can join the training program and how it is the fees or anything. Currently, HealthNet TPO is working within health system, so we are training those selected from the districts and remote areas, the trainees, and they are trained and they are deployed back on the health facilities in those locations. So that is donor funded, mainly with EU funding. We are doing it. So still we are not accepting currently the private, but Ghazalfar Institute of Health Sciences, they have 2-year diploma and they have through a program and it's still there. I think most of the questions I have answered, we are 10 minutes over, but really appreciate your participation and I think we are looking at health social counselors beyond the counseling services. We are looking at the more psychosocial support at community and multi-sectoral approach, more coordination, and more engage in planning and integration. That the diagram was shown at the end of the presentation. Our vision is bigger than only just having a counselor doing counseling, but also we are looking at the upgradation of these counselors for another couple of years training. So hopefully we are able to advocate for that and find funding and also see how we can upgrade further, especially the female health social counselors. And I think, Valeria, back to you.
Thank you all for joining us today. We're very happy to host this webinar. We will be posting the recording of this webinar on our social media channels. Thank you.
Thank you for everybody. Sorry for couldn't explain and respond to all questions, but thank you very much. Okay, thank you.
Thank you. Thank you for all of. Thank you.
Thank you, Valerie.
Thank
Thank you, Dr. Thank you. Thank you all of. Okay, bye.
Thank you. Bye.